Good afternoon. How's everyone doing? Almost there. Thank you so much, Jennifer, for having me come and talk about it. A topic I always am excited to talk about it, and I think is a little underrepresented, so I'm happy to give my 2 cents. Jennifer already kind of gave my punchline away, but this is my apology talk because this is the women's heart health portion of the program, and I'm not going to even talk about the heart, so I'm sorry about that. But I am going to talk about the cardiovascular system, and they're all really interconnected, and the sort of complex circulation system of vessels that come from the heart and end in the heart address and go to basically the whole body. And so a lot of the similar problems and pathophysiologies that we develop in the heart actually can develop and do develop all over the body, and really are sort of interconnected and are associated with some major problems such as stroke, aortic aneurysms, and peripheral vascular disease, which is what I'm going to focus on particularly today, which is basically when you develop this disease, and I'll talk a little bit more about that, in the legs, which is one of the most common locations for it, and an area of cardiovascular disease that I think sometimes is a little overlooked. So what is peripheral arterial disease? It's basically, as you can think about, what happens when people develop heart disease or you develop plaque or atherosclerotic disease within the blood vessels of the heart, the same thing happens within the blood vessels to the legs. And what happens is there's decreased or increased narrowing of those blood vessels, and as a result, decreased perfusion. And eventually decrease oxygen being delivered to those organs. And so really it's all about a supply and demand. As the disease process gets worse and your metabolic requirements and demands are starting to outweigh the amount of blood or the amount of oxygen that gets there, then you start to get some symptoms. The majority of patients with peripheral arterial disease actually are asymptomatic initially, even though you have it. And we'll talk about, even if you're asymptomatic, how important it is to recognize that you have it. But as the disease sort of progresses, the initial symptoms are when you increase your metabolic demand. So when you're exercising or walking, a very classic symptom of peripheral vascular disease is something called claudication, where you reach a certain level of activity and then you get symptoms of aching, cramping, pain, usually in the legs, that's relieved with rest. It's a very classic sort of picture for peripheral vascular disease. And then with increased and worsening disease, you can have those metabolic demands of your legs to be greater than the ability of your body to bring blood flow even at rest. And that's just a sign of really advanced disease, and that can, of course, lead to some frightening things, including non-healing wounds and amputations and gangrene. So why do I love to talk about peripheral arterial disease? Why is it important to think about as a sort of a spectrum of cardiovascular disease? And there's a lot of really important reasons. It's common, it's deadly, it's underdiagnosed, and it's undertreated. I'm going to try to quickly go through these without totally scaring you guys, I hope. So peripheral arterial disease affects 8 to 10 million Americans, and approximately 1 million Americans complain of new symptoms each year. And the prevalence is dramatically increased with age, and I'll show you that in a chart in a second. What I think is interesting is actually the age-adjusted prevalence of peripheral arterial disease in women is higher than for coronary disease, an age-adjusted coronary disease prevalence. So it's a big problem, and it's particularly a big problem for women is what we're finding. This is just a chart looking at the distribution with age, and again, as I mentioned, you can see there's a substantial increase in the prevalence of this disease with age. If you look in the 70s, it's just under 30%. 30%, 1 in 3 women, or people, sorry, this is men and women, have peripheral arterial disease. And if you get above 85, it's greater than 50%, so an incredibly prevalent disease. If you look at gender differences, I think this is interesting. Traditionally, a lot of cardiovascular disease is thought of as a man's problem. Peripheral arterial disease was right there along with it. But if you actually look at the gender-specific prevalence, you can see that it's pretty similar between men and women. But if you actually look at the disease burden, so the actual number of people with the disease, there's actually a higher number of women with peripheral arterial disease, and primarily because we're outliving the men. But certainly something to recognize and therefore to focus on with women. So let's talk a little bit about peripheral arterial disease specifically in women. I already mentioned that generally people are asymptomatic. However, when women become symptomatic, we find that they generally present with more severe and advanced disease than men. And it's not entirely clear why this is, whether they present later just because they sort of bear the symptoms longer or they don't recognize the symptoms longer. But they certainly tend to present with more severe disease. And also, if you kind of classify them in the same sort of clinical level of disease, women have a more significant functional impairment with the same level of disease than men do. And that's also not exactly clear why that's happening. There are some theories. Women also have smaller blood vessels, which may limit some of the treatment options or potentially cause some of the treatment outcomes to be worse. Although, again, a lot of the traditional studies looking at treatment outcomes and treatment results for women had low enrollment of women. So we're trying to change that, I think, and answer some of these questions currently. So why is peripheral arterial disease concerning or deadly? And the main reason is it's a marker of your overall cardiovascular health. So I said that the whole problem of sort of this developing of atherosclerotic plaque can really happen in your entire cardiovascular system. And identifying it in your peripheral vasculature, identifying it in your legs really tells me, or tells the physician, and tells you that you are actually building this plaque and you will have this amount of atherosclerotic burden throughout your body. And you have a significantly higher rate of stroke, heart attack, and death when you compare to people with sort of other equivalent risk factors but without peripheral arterial disease. And this is always a kind of a striking graph, I think. If you look at severe peripheral arterial disease, this is really advanced disease, but it certainly has a higher mortality than some of the very common or more common cancers out there, including breast and colon cancer. But peripheral arterial disease is also underdiagnosed. And I think obviously being asymptomatic or having these sort of somewhat vague symptoms makes it somewhat difficult. There's some theories that 1/3 of the patients actually have symptoms, but they don't recognize that those are peripheral vascular disease symptoms and just don't mention it to their physicians. But the problem is those same sort of statistically significant increases in mortality and MI and stroke are there even if you're asymptomatic. So certainly something to be concerned about and again, try and recognize. And you could argue that maybe it's because it's not easy to diagnose, but that's not the case. A pretty simple non-invasive test called the ankle brachial index can at least diagnose pretty sensitively, actually, and specifically for most people, whether you have the disease. And this is just basically taking a blood pressure in the leg and comparing it to the arm. And the blood pressure should be the same, if not higher, than your arm. And if you have a drop-off in a pressure, then that suggests that, again, you have some narrowing or blockage in those vessels as it gets down. And finally, peripheral arterial disease is undertreated. There's about 10 million people, Americans, with peripheral arterial disease. And if you think about half of them are asymptomatic, still only about 1/4 of those that are symptomatic are being treated. And what's worse yet is it seems that men tend to be treated, at least surgically, more often than women. Now, these, again, are some older studies, and there's some newer studies looking at an increase in trends and improvement in outcomes, but somehow this disparity between the amount being treated is still a little bit different between men and women, and we're not quite sure why. So now that I think I've probably completely frightened you about this disease process, I'm just going to step back for a second and focus what this sort of whole conference has been meaning to focus on, which is prevention. Huh? Pull them, yeah, the mindfulness app. Everyone pull out your mindfulness app. Actually, I need to get one. And let's talk a little bit about what we can do to prevent this or what we can do to treat this. Because the numbers are scary, but they certainly are scary because of, I think, a lack of awareness. And that's why it's exciting to sort of talk to people and get the word out there. I think you guys have probably been told about these risk factors throughout the whole day because they span the whole cardiovascular disease spectrum. But I wanted to speak a little more specifically regarding peripheral arterial disease. And these are sort of who gets it and the risk factors for peripheral arterial disease. I've already talked a little bit about age and the fact that the prevalence substantially increases with age. And unfortunately, right now, we don't have any solution or prevention for that. Some of the other major risk factors or diseases that are really rampant in our society, diabetes, high blood pressure, high cholesterol, and those things. And I think that they've probably had some conversations about that today, but I'm not going to really focus on those either. But I wanted to specifically focus on these last 3 risk factors, which include smoking, poor diet, and lack of physical fitness, because I think those are by far the most modifiable risk factors and preventable risk factors for this disease process. So the sort of topic of nutrition is a huge one, and I think it's really beyond the scope of my 20 minutes here today. There's some great guidelines, task force guidelines on sort of a heart-healthy diet that are specifically recommended for coronary disease. Actually, the guidelines are not specific for peripheral arterial disease, but I think, again, as I've mentioned to you, they're close enough, and there's enough connection between these 2 disease processes that generally taking those recommendations are worthwhile. There's some growing amount of data and evidence looking more specifically at peripheral vascular disease. Patients with peripheral vascular disease tend to have higher rates of high blood pressure, high cholesterol, and lower rates of certain vitamins and minerals than patients who do not have peripheral arterial disease. Specifically, there's finding that intake of folate and vitamins A, B, 6, B12, C, and E tend to be inversely associated with the rate of developing peripheral arterial disease. But this is still it's a very sort of large area and a relatively newer topic in terms of its focus on peripheral arterial disease, but certainly something to be focused on here. And I'm sure there's an app that goes with this, I think. All of these risk factors, it's so exciting now. There's a mobile app that we can consider and look in. Smoking is the strongest risk factor for peripheral arterial disease. Smoking is a greater risk factor for developing peripheral arterial disease than it is for developing coronary disease. Don't misinterpret me. It's very important for developing coronary artery disease as well, but it's just such a strong risk factor for peripheral arterial disease. Smokers, on average, develop symptoms of peripheral arterial disease 10 years before non-smokers, matched for everything else. So it's really a dramatic risk factor. And the good news is that quitting can make a major impact. So get on to that tweet to smoke, or tweet to quit. Definitely not tweet to smoke. But cessation can result in a 40% increase in walking distance. And there's a slew of other data out there in terms of the huge benefit in terms of symptoms and risk factors, cardiovascular risk factors, in terms of quitting smoking. And finally, exercise. There's a whole list of sort of ways in which exercise can impact cardiovascular disease as a whole, specifically peripheral vascular disease. Again, a topic that I could go on and on about for the whole day, but I'm going to really try and just focus on it. I wanted to just talk to you a little bit about this sort of vicious cycle of peripheral arterial disease quickly. I've already talked about what happens with peripheral arterial disease. You have this decrease in the perfusion and decrease in the oxygen delivery to the organ. And what happens is you get endothelial dysfunction. So Sandra already talked about the endothelium, which is the inner layer of the blood vessels, and they get injured when there's not adequate blood oxygen reaching them. And that injury can result in inflammation and free radicals, which can result in muscle denervation and atrophy and alterations in metabolism, which, as you can imagine, leads to poor aerobic capacity, reduced strength and endurance, which you can imagine results in more impaired walking ability and decreased quality of life, which brings us to sort of these conditions that I've already talked about are a risk factor for peripheral vascular disease. So worsening, increased deconditioning, obesity, hypertension, high cholesterol, and so on and so forth. So it's this vicious cycle that just gets worse and worse and worse and worse and causes that peripheral arterial disease to really become quite significant and severe. The interesting thing is the dramatic impact of exercise. It really almost affects, at least at some point in a positive manner, every step along this cycle of peripheral vascular disease. And so it's really impressive and really important, I think, to recognize and demonstrated in a lot of the data. This is just another look at sort of the impact of exercise in terms of just kind of stopping the functional limitation. And it's really that functional limitation that leads to some of these other complications, the physical disability and the cardiovascular events, which is really the biggest fear, I think, with this medical problem. So what are the goals of exercise therapy? Really quickly, it's to improve your symptoms, so decrease or reduce the limb symptoms, improve the exercise capacity to really stop that vicious cycle from getting worse, and of course to decrease the occurrence of cardiovascular events, because that's what makes this problem deadly. What do I mean by exercise? There's really actually very specific guidelines for peripheral arterial disease in terms of the treatment of exercise, and again, I don't really have time to go through it today, but most of the studies that look at the benefit for peripheral vascular disease in terms of exercise involve supervised exercise programs. So this is going to sort of like a rehab, cardiac rehab, exercise therapy program, and for at least 30 minutes, at least 3 times a week. And the point is to walk to the point of maximum or near maximum pain. And try and actually walk through that pain to a certain amount. And it's kind of like weightlifting, because if you can get to that point, then your body gets that trigger that, hey, I actually need to build more blood vessels here, and tries to increase the collateral flow or new blood vessels to kind of compensate for the blockage. And the program involvement needs to be greater than for 6 months. There's a lot of data in this in terms of the benefit of supervised exercise programs. There's ranges, obviously, but in general, it's pretty good, about between 100 to 180% improvement in the distance of walking to the onset of pain. This is just by walking regularly, but supervised walking and doing it regularly. 122% increase in maximal walking distance. So what about unsupervised exercise? I think that's the main question. I think all the studies are, it's very difficult to know how much people are actually doing. I think with the new technology that we're getting, such as the Fitbit, and that these newer studies are probably going to have a little better idea of what unsupervised exercise can do. But certainly we still see an improvement in symptoms with unsupervised activity. Obviously, supervised exercise programs have some limitation in that you have to get patients there and you have to pay for it somehow. And I'm sad to say that a lot of insurance, unfortunately, does not cover supervised exercise programs for peripheral arterial disease, which is just shocking to me because the data is just so obvious. The walking is by far the most commonly looked at exercise in terms of the benefits for peripheral arterial disease, but there are other exercises that one can do and that have been studied. I think the interesting thing here is that even just upper extremity aerobic exercise results in an improvement in terms of your peripheral vascular disease of your lower extremity. So it just really kind of points back to that benefit of that whole vicious cycle and the multiple ways that exercise really can benefit. So what about if you don't have peripheral arterial disease? What is the impact of exercise and physical fitness in terms of preventing this disease process? Well, I don't think it's a surprise to anyone, and you've probably been hearing about it all day. It's obviously very significant. This is a study that was like a large population-based study and basically looked at physical fitness and then sort of followed them along and determined the rates of peripheral arterial disease. And you can see that subjects who reported any amount of physical fitness, this is just any amount, just by reporting, there was no monitoring of these people or anything, there was a 36% lower odds of peripheral arterial disease in those patients. And this was across the board. There was no difference or no greater benefit to any sex or race or age. It was just if you exercise, you did have a decrease in risk of peripheral arterial disease. And that benefit in terms of prevention or decreased risk of peripheral arterial disease increased with the frequency and intensity of the exercise. So the more intense the exercise, the increased benefit of it. So I'm going to stop here. I think I've kind of gone along already. I thank you guys for letting me chat a little bit about peripheral arterial disease, which, as I've mentioned, is a pretty significant problem. But I think it's exciting because there are a lot of risk factors that can be addressed, and I think we've talked about it today in some exciting new ways to address them. So, yeah, thank you.
So it would, we have the same problem with cardiovascular or with coronary disease, is that it's not always paid for, and particularly since the program's pretty straightforward and people aren't going to keel over like they do with coronary disease. You could really set up some sort of program like this. It'd be really interesting to study.
That's exactly what I wrote on my notebook over there while you guys were
talking.
Set
up a study, so. Yeah. So we'll have to get Jody and do that. So are there any questions from the audience in terms of what we talked about today? Yeah. Dr. Chandra.
Great question. I think that most any physician should be able to direct you in the right direction of first step getting the ankle brachial index study. It's a really quick, non-invasive study. Some clinics will just, or some physicians will just do it in their own clinic, or you can get it in a formal vascular lab. But I would mention it to your primary care physician, your cardiologist, your OB, whoever it is, and mention your symptoms. And I would even so much as mention ABIs, because that's the best next step, and it's really easy to do. The main risk is cardiovascular risk.
They're going to keel over.
So there's my patients ask me all the time, because it's scary when you have peripheral vascular disease and you walk and you have this crippling pain in your legs and you automatically think, oh my gosh, I'm hurting myself, and you stop. And so I tell my patients all the time, if they can, from their heart perspective, tolerate it, keep pushing. It's like weightlifting. You can't really hurt your legs. A little bit, and you could see there was a couple of dotted red lines. A little bit, you can initially have a little bit of muscle injury, but very minor. You really would never be able to get yourself to a point which would be dangerous in terms of your legs. So the limitation is really your other physical fitness sort of situation. It is similar. So, well, diabetics have very high rates of peripheral arterial disease. They also have high rates of neuropathy, which is, numbness and pain, and they oftentimes overlap. And sometimes the symptoms that diabetics have in terms of their leg pain or foot pain or walking pain is from the nerve side more, and sometimes it's from the artery side. So it's a matter of evaluation and testing that can really help determine that. For chemotherapy, that's mostly also peripheral neuropathy usually, and so that's a different situation and doesn't necessarily involve the arteries, although these patients can still get it. But